Okay, so now we're going to talk about some shoulder strengthening exercises. We're going to start off with some isometrics. Isometrics are pretty simple, guys. You guys should be pretty familiar with how to do them. Essentially, on your paper, it just goes through and it lists every motion that can occur at the glenohumeral joint. So we're talking flexion, abduction, adduction, external rotation, internal rotation, even including scaption in there. And essentially, you're just having your patient go through those motions and getting an isometric contraction at some point. Like doing the multi-angle isometric exercises that we showed you with the knee or with the elbow that you can do. Just have them go to a certain angle and you provide some resistance, or you have them hold at that position to increase the strength in those motions. Scapular, it's kind of the same thing. So scapular is pretty easy with like elevation and depression. You can have them come up to something and try and lift up against a nice heavy object, and as they try and just pull into that elevation, then they can get that isometric contraction. Or if they're just pushing down into it, have them seated, whatever you want to, have them push down and get those isometric. Same thing with protraction, retraction. They can push up against the wall or try and pull something that's, again, stationary. You can add in some PNF techniques just because it mentions it on your paper there, where you can have them do some alternating isometrics anywhere within those PNF patterns that you guys are familiar with. Then we get into what are called prone Blackburns. And this is just a combination of different exercises to strengthen those scapular stabilizer muscles. So we start off in a prone T, which essentially is you're getting your patient into prone. Obviously, they're called prone Blackburns, and so Blackburns, excuse me. So all the exercises will be done in prone. You have them down here. And you can have them in neutral, so essentially their thumbs are straight out, and they form a T, come straight up. Then you can have them do an external rotation and supination of the forearm, so thumbs up. They're going to come up. Then you can have them do Ys as well. Same thing. Y is you're not coming all the way up to here. You're keeping in more of a scapular plane, if we were standing kind of thing. And then again, you can have them do it neutral, so their thumbs are pointing forward, come up, and then thumbs up into external rotation. Then 90-90, so you have them come here where you got 90 degrees of shoulder abduction and then 90 degrees of elbow flexion. Again, have them come straight up. With all of these, you're cueing your patient to try and pinch their scapula together, because these are scapular stabilizer exercises. So you don't want them necessarily doing this. You want them really pinching those scap together as they go through it. And then you have prone extension, where you can have them arms at the side. They're coming straight up. And then again, you can have them do it externally rotated. So now thumbs are out as they come up. Okay. So those are our prone Blackburns. The next ones, we've got adduction with a TheraBand. So pretty simple. We can use these guys here as our examples. Instead of using a TheraBand, we've got our sport cord, but you're having your patient out here just coming down into adduction. You can do some horizontal adduction as well with it. Scaption, if I wanted to use my sport cord for scaption, I'd put it down here, because that motion scaption, now we're coming up in about 45 degrees into that scapular plane, like so. There's our scaption. You can do scaption if patients are having a hard time figuring out that 45 degrees. Don't have a really readily accessible corner. We can pretend like this one is accessible. If they go into the corner and just go straight into it, then on either side they should end up having about that 45 degrees or in the scapular plane, and then you can apply some resistance either with TheraBand or have them hold on to a weight to achieve that scapular plane. You can do the same thing lying down. If they have a table or a bed or something that's up against the wall, they can lie down on it and then again kind of lean back into it. If there was a wall right here, then I'd stop and I'd end up again in that scapular plane. In that position, TheraBand usually works a little bit better than a weight, a dumbbell or anything like that. And then flexion, you can do just active range of motion with the TheraBand or with the weight again. You can have them do it supine, lying down, lifting up into that flexion. Again, I feel that in supine, TheraBand probably works a little bit better, but you can still, just because you're going to get constant or resistance throughout the entire motion, as opposed to with weights, you're going to come to a certain point and you're going to actually start working the opposite muscles. Sitting, and then again in standing. So you guys should be pretty familiar with each one of those and should be able to come up with some exercises hopefully pretty easily. Okay, so the next exercises we're going to talk about, it's another group similar to the prone Blackburns, but this is called the thrower's 10. So it's just a combination of 10 different exercises, holding up the right number of fingers, 10 different exercises that are great for a lot of overhead throwing athletes to, again, strengthen and stabilize the shoulder as well as the scapula to just decrease the possibility of injuries and increase their strength. So the first few are pretty simple. We've got internal and external rotation. You can use a TheraBand, or for this one we're going to use our sport cord, just because we got it here and it's easy. You're going to put a towel in between their body and their arm, again, to try and just keep them into a little bit of neutral, as opposed to if we come here, then maybe the patient starts to dig in too much and they just get bad mechanics with it. So this can help with that. So internal, and then if we were to, I could switch around, I'll just switch arms. We can do that external rotation as well. Again, trying to just cue your patient to pin that, not let the the towel drop. Then we got 90-90 for our internal external rotation. And so then again, anytime we hear 90-90, it typically means 90 degrees of shoulder abduction and then 90 degrees of elbow flexion. So now we're going into internal or external rotation that direction, or we can go into internal rotation down. We can follow that up with some side-lying external rotation as well. So that one's pretty simple. You just have your patient lie side-lying and they go into external rotation. Again, you can put a pillow, or I keep saying pillow, a towel in between their arm and their body as they pull out. That one is actually quickly becoming a pretty big favorite amongst a lot of therapists that treat patients with or that are baseball players or overhead athletes. They really like that sideline external rotation with TheraBand or with a weight. Next one, full can TheraBand scaption. So full can, I don't know if we've ever talked about this, but you'll hear the terms full can and empty can. And essentially full can just means, or you can look at both of them as if you're holding a soup can that's had the lid cut off. And to keep all the contents, obviously you have to keep the can upright. And so that's the way you're going to have your thumbs essentially is pointing up. That would be called full can. To do empty can, then it's like you're dumping all the contents out so your thumbs go down. And that is called an empty can position. So for this one, we've got the full can TheraBand. So the thumbs are going to be up. And again, we go into that scaption about 45 degrees like we talked about earlier in the video. Lateral raise, palm down. So this one's pretty simple. It's just simply shoulder abduction, keeping those palms down so we're not allowing them to go into external rotation. We're just focusing right on that middle deltoid primarily, and coming into that lateral raise. You can have them doing bilateral as well. Next we've got Y with TheraBand for retraction and external rotation. So these ones, again, you can use your TheraBand or you can use a sport cord, and they're just going to come up into that Y, and we're again moving the glenohumeral joint, but we're also trying to focus on having them squeeze those scapular.
Whoa.
Just wanted to make another dent in the wall. Trying to squeeze those scap together when they get close to the top there. They're coming up and then really squeezing it. And then you can do the same thing with external rotation. We're still getting that retraction while they go into external rotation. Or if we want to keep them in the Y, we have them just do straight external rotation and supination of the forearm. Again, focusing, I don't know how much you could hear that, but they're going up, keeping the elbow straight, and as they come up, they externally rotate at the shoulder and then go into supination of the forearm. But again, making sure they're focusing on squeezing those scapula together. Then we got our rows. Again, you can do this with TheraBand or you can use a sport cord. Got TheraBand here, so I'll use this guy. You have your patient hold on to it, and it's just a simple row back to start off with. Again, we're bringing that or causing glenohumeral motion, but also focusing on squeezing those scap together. So that's the standing row with arms aside, and then you can do a high row into external rotation. So we're getting a row at 90-90 position with our shoulders and our elbows. And then some people may call this a face pull, where you're pulling it towards the face and you come out. Or you can call it a high row. And then you can have a face pull with external rotation, or a high row with external rotation. So you come up and you go into external rotation like that. Again, focusing not only on the glenohumeral motion, but also the scapular motion, and bringing those together. Then it says you can do a high row. You can challenge them a little bit more on a stability ball, and then staying on that stability ball, just have them do that high row with external rotation again. If we want to get more of the lower trap with a row, then we'll do a what's called a W row. So we're going to keep it like a low row or a normal row, but then we add in that external rotation and try and pinch those scap together. Bicep curl with TheraBand. That one, again, you guys should be pretty smart enough to figure that one out. Tricep extensions, so overhead. You have them hold on to back here, and then they're coming straight up to get those triceps. And then TheraBand wrist flexion and extension. So now they're just holding it down here, pulling up into flexion, pulling up into extension. You can wrap the whole thing around and have them keep their fingers as extended as possible throughout those motions as well. And then supination, pronation. To start off with, maybe you just have them working that grip with a ball and just going into supination, pronation. Then for more strengthening, we utilize our mallet. And I suggest, as you're watching this video, try and identify what the concentric and eccentric portions of the supinators and pronators are.
Especially brachioradialis.
Woo! What? And that's our throwers 10. Okay, so continuing on, we just finished our throwers 10. We'll get some more glenohumeral and scapular stabilizer exercises. The first one is our forward punch. So you can have, if you've got some resistance band or a sport cord or a TheraBand, whatever, have your patient standing like this. They're kind of in a neutral position as far as their scap goes. That will allow them to just go forward into that punch. So we're working on serratus anterior and other muscles to help strengthen that scapular motion and stabilize it. You can have them do it lying down, supine as well. So they would just hold again onto a TheraBand or whatever need be, and have them do that press out or forward punch. Next, military press. You can do this just active range. You can do it with a TheraBand or with a weight. And we're just coming up here and pressing up as we go into that motion. Okay. I'm showing you this because Craig said that his shoulder pops every time that he does it, and he didn't want to go through that. So that's our simple military press. I will tell you that there are a few people out there that are like, don't do military press, it's terrible for you and it's bad, it's for your shoulder and all that fun stuff. Take it with a grain of salt. You know, if it works for your patient and they're okay doing it and it's not causing any damage and it's appropriate, go for it.
If you're a weenie like me, don't do it.
Or if you're a weenie like Craig, don't do it. PNF diagonals with TheraBand, or let's see, I've got TheraBand here. So I know that some of you last time when we were doing kind of a preview or at some point we're kind of doing some of this with TheraBand. You can go have your patient go into those diagonals by just standing on that TheraBand, going into the motion. So this would be D2 of that upper extremity, and if we want to do D1, then we'd have it up here, or we could come down here. If we want to work more of flexion for D1, and depending on where we attach or have the resistance coming from, we can work either flexion or extension in those.
Just
patterns.
don't have them do the finger component of the pattern.
Right, because then they'll let go, and then it doesn't do any good. Let's see. Oh, where am I at? Oh, trampoline throws, plyometrics. So we can do plyometrics with our upper extremity. Trampoline throw is a great example of this. So we're getting that quick. And this is the lightest weight, so I'm not getting much of a stretch or an eccentric component. If I maybe grab that yellow one or a heavier one, as it came back and I slowed it down, then we're getting that quick eccentric stretch, and I'd go immediately into the other direction to get that concentric contraction, and that would be considered plyometrics.